Hello and welcome to your podcast, Classes Off with Rosa. This is the show where you'll find reliable data to help you find solutions to common problems. I am your host, Rosa Antonini. Do you or a loved one have a health condition in which conventional medicine has failed? And have you wondered if there is anything else out there that could help you treat or cure the problem? Well, today we'll have some great information that could just do that. I'm talking about Chinese medicine, and I am super excited to have with me Dr. Alexander Hein. Dr. Hein is a dual board certified who graduated with a biology and environmental science degree and received his doctorate of science in Oriental medicine at the National University of Natural Medicine. He has a doctoral research on the spontaneous remission of cancer in classical and Chinese medicine. Dr. Hein, how are you doing today? Welcome.
Good. Thanks for having me here, Rosa. I'm excited.
Yes, I am super excited to have you here with me because you have such great knowledge into Chinese medicine. But before you get into that, I read something about your story that you were trying to get into the traditional medicine schooling, but somehow your journey ended up that you were in the Sahara Desert for 5 days without food. Is that
Yeah.
true?
What ultimately got me into Chinese medicine specifically was really being sick for a long time. For me, when I was a kid, I was always passionate about medicine. I loved reading these doctors' stories. My main passion as a kid, I loved reading about like holy people and mystics, doctors and shamans, these kind of traditional healers through history. And eventually what happened though was that through my own course of illness, the path from going into traditional medicine became less and less viable. For me, I always had a lot of digestive problems from childhood. And eventually it got to be really, really bad when I was in college. I was doing my undergraduate in biology and environmental science down at Clemson. And I had so many GI problems that I started seeing all these doctors. And when I went from, the general referral system in America is, you go to the general practitioner, maybe they refer you to a dietitian and then a GI
Mhm.
doctor, and then maybe even a surgeon or another specialist from there. And I went through the whole referral system, about 4 or 5 doctors. And not only did they not tell me what was going on, nothing that they gave me really helped me. And
Oh,
so I
wow.
was a little bit discouraged because I was like, well, this is the profession I'm going into and it couldn't help me. I still had problems. So at that point, I began trying everything I could find on the internet. So anyone who had similar problems to my own, I started taking whatever their advice was. I read books on nutrition, books on taking supplements and things like that. And still nothing was really dramatically improving. And I saw all kinds of alternative people from energy healers to naturopathic doctors to acupuncturists. And ultimately, I was once in a cafe one day. I was sitting down drinking a cup of coffee and I was very sort of disheartened because nothing was working. I
Mhm.
still I still had all these problems. I ate healthy every day. I exercised. I didn't have a stressful job. It didn't make any sense. And I met a guy that was actually the barista, at the coffee shop. And he said, I have a really, really serious illness. I have an autoimmune disease and I had a bad reaction to one of the medications. And now I have an even more serious disease. And I saw this Chinese medicine doctor and he didn't cure me, but he helped me more with the symptoms than any other doctor I've ever seen, especially my internal medicine doctor. So he said, I don't know about you, but maybe just go see him and maybe he can help. So I saw this Chinese medicine doctor who, coincidence, was only 5 minutes from my parents' house. And, he gave me an herbal formula that was about 1,000 years old in Chinese medicine, the
Oh,
famous
wow.
formula. And I had the best digestion the next 30 days that I had whole in my prior 28 years of life. And that's when I realized that there are all of these medical options that may work even better than the best specialists that go to the most prestigious universities, Harvard, Yale, Stanford, but no one knows about. And for me, the biggest difference was Chinese medicine, especially the herbal medicine, these herbal prescriptions. So that put me on a very long journey. Um, you know, Interesting. I'd actually lived in China and I speak and read Chinese. I lived in China when I was 23, but I didn't even end up trying Chinese medicine until I was 28. Very funny, sort of
Oh.
living life in reverse. So that's what made me stop considering conventional traditional medical school. And that's when I really focused on Chinese medicine, trying to find the best doctors in the world.
Wow, that's so interesting. And, I know that you work a lot with patients with digestive disorders and anxiety, depression, and also women's health. And I have a little story on that as well. A couple of years ago, I always had a heavy flow on my periods. It's always happened. And then a year ago or so, a year and a half, two doctors wanted to do surgery. They said that I really needed surgery. One actually was considering an emergency surgery because once of the heavy flow, but also like a fibroid that was large. And I don't know, it's a lot of medical terms that none of them were good. So I got in touch with someone that recommended this brand. It was a Chinese medicine. I actually didn't know at the time any Chinese doctor. Otherwise, believe me, I would have gone and see you.
Right,
But
of
I
course.
found this, yeah, I found these pills, Chinese pill, especially for women, and they are not like the traditional medicine that they cure your pain right away and you feel better. I remember it took like 3 months for me to
Yep.
see results, and maybe 6 months for that I went back to the doctor. And the doctor actually was surprised, to say the least. I mean, he was like, he couldn't believe it. Everything was gone. I was completely fine after 6 months of having these, Chinese pills every day. So, and yeah, and he's been completely fine since then. So, can you give me or help us understand a little more what are those main differences between the traditional medicine and the Chinese medicine?
Yeah. And look, your case is a great example, right? I mean, I treat a lot of women, for example, that had pap smears. There's a grading scale for how much cervical dysplasia has changed, right? So these kind of precancerous changes that predispose women to increased risk of cancer. And similar to you, I have a very recent patient, he's only 25, and her OBGYN or her gynecologist was recommending surgery and said, there's a surgical procedure where they have to remove a part of the cervix because they remove those precancerous cells. And I gave her a formula for 4 months. And the next time she had a pap smear, it came back completely clear. And the doctor said he had never ever seen it, and he wanted my contact information. So those kinds of results are possible. They're common if the person is a skilled doctor of Chinese medicine. And these kinds of things, doctors still don't know. They're not familiar, and this goes back to one of the core tenets of Chinese medicine is, one difference that I see is that in Chinese medicine, there's a concept called the root and the branch. The root is
Mhm.
what causes a problem, and the branch is often a symptom. So, for example, conventional medicine is almost entirely symptom focused. And
Yes.
it's okay if it's an acute problem, like you need antibiotics and then the infection is cleared and then you're back to normal. Problem is symptomatic treatment does not help people become healthier for chronic diseases. And that's the majority of the medicine that I focus on. Because let's say you have depression, or let's say you have GI problems, let's say you have gynecological problems, like you have dysmenorrhea, you have very painful menses, or you have a fibroid or a cyst. Well, the solution almost always in conventional medicine is medication for the rest of your life. And that's a problem if you're 25 or 30 or 35 or
Mhm.
40.
Yeah.
Same for cardiovascular disease or heart palpitations. A lot of these conditions, heart palpitations can be purely due to stress, or even for a lot of people with digestive problems have heart palpitations. And people are put on beta blockers when they're 35 for the rest of their life. So the big thing, Chinese medicine is focused on both the root and the branch. So, for example, someone comes in with anxiety or depression and they see a traditional doctor and they're given an SSRI or some class of antidepressant. Very often they're on those medications for years. Sometimes they don't even
Yes.
talk to the same doctor for years. They just keep refilling. But in Chinese medicine, the goal is, of course, we want to treat the acute anxiety and depression. If you're having panic attacks every day, we have to treat that because it's difficult to work or to be a mother or to keep your job, right? But the goal and what I see happens clinically is when you treat the root, whether it's with Chinese formulas or acupuncture or also with lifestyle, what happens is 6 months from now, you don't have those symptoms anymore, or they're 90% reduced, and you don't need any medication or any herbs. So, a big difference that I see is that we treat both the root and the branch versus just the branch. a lot of conventional medical treatment, a lot of medications, even cancer, treat just the symptoms, right? And I mean, look at the recurrence of cancer. It's unbelievably high for
Yes. Hmm.
overall general cancer recurrence is very high. And look, there are, there are many cancers and many cancer types. It's always case by case where sometimes surgery alone is curative, right? Some cancers, just surgery alone, removal of the tumor will cure the cancer.
Hmm.
And a lot of times it won't. So this is again, root first branch. The second difference I would say is this idea that it's really the medical philosophy. So the idea that, in conventional medicine, usually symptoms like, let's say, anxiety and depression reflect physiological issues, right? It's viewed as a chemical disorder, issue with neurotransmitters. So the view is almost, it's not an explicit view, but implicit that the person is damaged and they need these medications forever, especially
Okay.
depression and anxiety. But in Chinese medicine, the view is that there is a quote unquote healing force. And when you strengthen that healing force, the person not only can be healed, but they don't need any medication forever, whether it's Chinese herbs or it's antidepressant or whatever. So a lot of what we try to do is in my lineage is we call it strengthening the yang. The yang qi is like your immune system. It's
Hmm.
your resources. It's your vitality. It's your energy, not in a mystical sense, but energy in a practical sense. Everyone recognizes vitality when they see it. The bright shining eyes of a 9-year-old girl, bright eyes, energetic. She
Hmm.
laughs easily. She smiles, and compare that to a 90-year-old person that's on their deathbed. The lights are out in their eyes. They're
Hmm.
lethargic, they're slow, their skin is dry, they're inflexible. So every human being instinctively recognizes what vitality looks like and feels like. And in our point of view, what we're trying to do is strengthen that healing force in the body. And that is ultimately the point of acupuncture or using Chinese formulas or using moxibustion. All of these therapies are to strengthen the root. The root is really the core organ or organ pattern or physiological imbalance that is predisposing this person to chronic symptoms. Because look, ultimately, why somebody gets sick is one thing, but why they stay sick is another thing, right?
Right. You
Because
mentioned,
go ahead.
yes, go ahead. Sorry. No, I was going to ask you, you mentioned this anxiety and depression. And I think this is an issue that is affecting most people every day in our society. I mean, I have gotten a couple of fans actually on Instagram where they're in the early 20s, and actually one was in the late teens where they have already considered suicide. So let me ask you something. When a young person, actually anybody, is facing those emotions, how can they determine, or how is the process to know, okay, this is the type of depression that needs to go into those traditional medicine, or maybe this type is better for Chinese medicine, or is there something in between in which they need to be combined? What do you think?
I mean, I think the more options the patient has, the better. I mean, my ultimate goal is for the person first to be safe. So if it's acute anxiety or acute depression to the point where there's suicidality, then they should absolutely see a primary care doctor first to make sure that they're safe.
Okay.
And then I think the goal from there is to work on longer term healing. And, there are multiple factors, right? It's not just one thing. It's not just even the best psychiatrist who wants all their patients on medication will not say that anxiety and depression is just chemical, but there's absolutely a physiological or chemical aspect. And so I think the best solution for people is, they call it, it's often in the literature called the biopsychosocial model, biological factors, psychological factors, and social factors for anxiety and depression.
Mhm.
So look, I mean, I think the more options the person has, the better, right? And ultimately, the goal
Yes.
should always be to get off medication if they're able. And most of the time, even if my patients have had depression for 10 years and they're on 3 antidepressants, I'm usually still able to get them off.
Wow,
So
that's
you're,
really interesting. I actually have had in the family people dealing with depression, and it's
yeah.
like it's such a long journey. What are the type of issues or health issues in which you've seen the best results from Chinese medicine? And which one do you think maybe a traditional medicine or conventional medicine could work better?
So What I've seen mostly where Chinese medicine responds the best, I mean, general internal medicine, I find that most of them are very, very effectively treated. So, anxiety and depression, digestive disorders, sleep disorders, a lot of integrative cancer care is also really benefited from supplementing with Chinese formulas if you find an oncologist who will work with them. Musculoskeletal, so physical pain, gynecological conditions. I would say there aren't many that I find don't respond to, but there's a few that come to mind. One, later stage osteoarthritis, for example, when you see people needing joint replacements, hip replacement,
Okay.
knee
Mhm.
replacement, some of those, there's just so much damage over a long period of time that it's just for most, for some of those people, they just really need a joint replacement and it's a better option. I would say definitely late stage cancers or cancers where they really need to do surgery because the person will do better getting those tumors out.
Mhm.
Some conditions like ALS, I don't, it's very difficult. It is ultimately a terminal disease, right? ALS. Those are the few that come to mind right now. But honestly, the general internal medicine, which is most of the conditions that people go to their doctor for, my experience is primarily formulas. I specialize in formulas in internal medicine, unbelievably effective for most of those conditions. There's, of course, like you talked about, fibroids and cysts. There are formulas that you can see clinically to dissolve small fibroids.
Yes.
Yeah.
Can attest to that.
Yeah, I mean, you could save 100,000 women a year from surgery just by giving them those formulas. So, but there is a certain size where fibroids get, the general consensus in my profession from the doctors I studied with. If it's about a walnut size or smaller, there's a good chance you can dissolve it in about 6. If it's bigger than that, it's a lot more rare. Every now and then I've seen someone with like a grapefruit sized fibroid dissolve, but it's rare,
Mhm.
very rare.
Okay.
So I would say there's a certain fibroid size, where it's just better to get surgery because there's often just heavy bleeding associated. And women can be really, really exhausted from that. But those are the ones that come to mind right now.
Yes. And but now, how can someone, I mean, Amazon, so everything seems to be there, and there is a lot of marketing and a lot of products that don't work, but they are
Yeah.
promoted as Chinese medicine, and you're gonna get all this benefit. How can a consumer that is just browsing and trying to find, I don't know, some relief or something, how can they identify real legit Chinese medicine versus the scam that is in social media?
Yeah. I mean, honestly, the only thing I would say is go through a licensed practitioner. I wouldn't buy any of it online personally. For me personally, it's hard enough to find good Chinese medicine practitioners, right? I don't think most are that skilled.
Mhm.
And that's tricky because the problem with the education of acupuncturists and Chinese medicine doctors. So personally, I wouldn't even buy Chinese medicine online. I would only go through a local doctor that find a skilled acupuncturist or a Chinese medicine doctor and only ask them. Because even the herb companies that I buy from, I know the owners of the herb. So I know where the herbs come from. The formulas are also tested independently. So I personally wouldn't recommend anyone to buy things online, to be honest.
Okay. Dr. Hein, so is there a place where someone can find different doctors that work with Chinese medicine?
That's a good question. One resource I'd recommend is my mentor, Heiner Fruhoff, has a website, classicalchinesemedicine.org. And I think they have a find a practitioner listing. And those are, good quality practitioners that they know and they've vetted. I would say another good resource would be to go through the Chinese medicine schools to see if they have practitioners they recommend because I don't it's tricky. There is no overall listing. Mostly consumers have to find out for themselves, like via Yelp reviews or Google reviews. So, but I would definitely recommend going through classicalchinesemedicine.org, which is a mentor's website, and they have a find practitioner little tab there.
I know you work a lot with patients that are dealing with weight issues. They are
Mhm.
trying to lose weight. They have tried different stuff and they're dealing with all the emotional burden that comes from low self-esteem and all this stuff. Because if you try to lose weight, you try all these different diets. There are so many diets available that for someone trying to lose weight, I can just imagine how overwhelming that is, especially you try one thing doesn't work, you try the next one doesn't work, or maybe you lose some pounds and then you just stop, go back to the normal routine, and all of a sudden you get all your way back.
Um,
So, can you tell us a little bit how this is different with Chinese medicine?
So for some people, there are the obvious causes of weight gain, right? But for a smaller percentage of people, there are other causes. Like, for example, there can be issues in Chinese medicine, very often I see issues with the spleen, which is really the pancreas, issues with the kidneys. Very often there are hormonal issues for women. For example, often clinically see women gain a lot of weight around menopause, even some women that have never gained weight in their whole life.
Okay.
My mom has been very, very the same body weight her whole life, basically from regular exercise and diet, but even around menopause gained a few pounds that she never had gained before. Very often you see issues with the microbiome. So that usually falls into the pattern of kind of spleen qi deficiency, as we say, which is people often have long-term digestive issues. And so there can be long-term changes in the microbiome that predispose people to weight gain in some cases. And I would also say, people have to rule out the obvious. Sometimes it's just medications. There's a lot of people who are on, for example, varying dosages of antidepressants.
Mm.
Sometimes it's those medications that are a big cause and they don't make the connection because either they've been on the medication for a long time or their doctor says it's not related. But I do find that clinically, there are plenty of people who, when they get off medications over the next year or two, very slowly will begin to lose weight. But very often end up treating a lot of the time digestive problems like the spleen, which is mostly the pancreas,
Mhm.
the kidneys as well, or often I'm treating hormones or the microbiome. Those tend to be sort of the more overlooked on the medical side issues for stubborn sort of weight gain.
And how long have you seen, like, how long would it take pretty much for someone to lose, I don't know, 10, 20 pounds? And do they need to continue a specific regimen to keep that weight off?
Well, it depends on if we're treating the core issue, right? This goes back to the root and the branch, right? If we're treating, if the underlying issue is an issue with the digestive system or issue with hormones, then very often the weight will come off and will stay off. But if there's an aspect of lifestyle as well, then they're probably going to have to work on the lifestyle more. But,
Okay.
I have a few women who've had really stubborn weight and they do eat well and exercise, but it's more likely a medical issue. And what I found is that very often within about maybe 3 months, they're able to lose about 10 pounds with the Chinese formulas. So a lot of the time we're working on digestion in that case.
Okay. And it's like you said, it's not working on the roots, right? Instead of just trying to get a quick fix, a lot of people just want, like, okay, give me a pill, give me something. And I just want to see those magic results in a week or two.
Right. Absolutely. And sometimes sometimes medication is easy now and hard later. You know what I mean?
Mhm.
It makes your life better now, but it's harder to get off later and still feel the same.
Okay. And I know you treat allergies as well. And I wanted to ask you, have you seen results of Chinese medicine treating allergies? And this is because I don't know, it seems that in United States at least, the number of allergies keep increasing. The kids at school, actually adults developing allergies. Um, and me personally, sometimes I question the stuff that we do, the environment. Why are we becoming allergic to so many things? Do you have any information about allergies and what could be the source of those food allergies that we're getting?
Yeah, well, that's one of the most common issues I see today. I do find that most food allergies are able to go away with long-term formulas, so that's the good
Mhm.
news.
That's
My own
good.
girlfriend, she had long-term issues with, for example, acid reflux, especially triggered by like peppers and things like that. And she
Mhm.
had seen a nutritionist and a GI doctor who said that, these issues tend to increase with age and you're never going to be able to eat them. But of course that wasn't true. And I treated her for 3 months and those went away. I find that most often, there is a disruption in the gut and people call it leaky gut these days. Right. So there's an issue with the small intestine very often. And what I find is for a lot of people, it's often a 3 to 6 month treatment window for formulas. And
Mhm.
then very often they can begin reintroducing those foods. But where this all comes from, I don't know. That may be anyone's guess. It may be Roundup. It may be pesticides. It may be medications in the runoff, the water runoff. I don't know. Ultimately, I haven't looked at all the environmental causes, but it's GI is absolutely epidemic these days. All the sensitivities, all of the, but not the only one, right? Anxiety and depression are also. But
Yes.
the food allergies, the food sensitivities like that is a really big problem. It's one of the most common issues we see. And I think there are probably a myriad different causes, but I do find that most of them are able to go away. It's probably maybe a 3 to 6 month window with formulas, and then the gut is strongly rebuilt and they are possible to go away.
That's really good to know, especially when you have children with allergies. It's very scary time when they're having a reaction. So, it is good to know that you've seen people getting out of those allergies within 6 months or so.
Yeah, and it depends on the stage in the grid, right? Some kids will naturally outgrow things. Some kids even, for example, have asthma and will naturally outgrow it, and some don't. I mean, asthma runs in my family. I still have asthma as an adult. No one else still has it. But some kids will have, it depends how you define allergies, right? Anaphylaxis, like where they have life-threatening reactions to peanuts, are different from obviously, let's say, someone who eats gluten and they get very constipated or they get a rash. So it always depends on case by case, but very often people are surprised to see that those can go away.
Well, thank you so much, Dr. Hine. This is really good information. Is there any other final remarks that you would like to give our listeners?
I would just say if the person really wants healing, meaning they really want freedom from everything, freedom from any kind of medical treatment, see someone who's really good at looking at their health problems from an integrative or alternative point of view. I don't think most people need to be on medication for the rest of their life. So there is another way.
And this concludes our episode today. Thank you, Dr. Hine, again. And if you want to know more about Chinese medicine or about Dr. Alexander Hine, please visit alexanderhine.com. You can find his link and all his social media information in the description of the podcast. Thank you so much for listening, and I hope this information was helpful. If you like this type of content, please subscribe and share. Coming up, we will have more topics on mental health, weight loss, the issues with our education system, depression, global warming, and much, much more. Stay tuned. See you soon.